Have you ever wondered why your doctor recommends a colonoscopy even when you feel perfectly healthy? You have no pain, no bleeding, no digestive problems. So why should you have a colonoscopy? The answer may surprise you. In this video, I will explain why people without any symptoms are often the ones who benefit the most from colorectal cancer screening, and how one simple procedure can actually help prevent cancer before it ever begins. This is probably the most common thing I hear from my patients. Doctor, I feel completely fine. Why would I need a colonoscopy? If you have ever asked yourself the same question, you are definitely not alone. It sounds completely reasonable. After all, most of us believe that if something serious is happening inside our body, we would notice it. Unfortunately, that is not always true. Most people expect serious diseases to cause symptoms, pain, blood in the stool, constipation, diarrhea, or unexpected weight loss. So if none of these symptoms are present, it is natural to believe that everything is normal. But early colorectal cancer, and especially colon polyps, usually do not behave that way. Many people feel completely healthy while these changes slowly develop inside the colon. The purpose of a screening colonoscopy is very different from the purpose of a diagnostic colonoscopy. When you already have symptoms, we are trying to find the cause. But when you have no symptoms, we are trying to find problems before they ever cause symptoms. That is the true power of screening. It is about prevention rather than treatment. Let me introduce you to John. John isn't one specific patient. Instead, he's a typical example based on many people I've cared for throughout my career. His story represents thousands of healthy adults who never expected a screening colonoscopy to change their future. John is 46 years old. He works full-time, exercises several times a week, and enjoys spending time with his family. He doesn't smoke, eats reasonably well, and has no abdominal pain, no rectal bleeding, and no digestive complaints. From his perspective, there is absolutely no reason to believe that anything could be wrong. When John's primary care physician recommended a screening colonoscopy, he wasn't convinced. Looking at his busy schedule, he thought, I'm healthy. I'm too busy. Maybe I'll do it next year. After all, why would someone who feels perfectly well need a colonoscopy? John kept telling himself, nothing is wrong with me. He looked healthy, he felt healthy, and he had no reason to suspect that something abnormal might already be growing inside his colon. The challenge is that our bodies do not always send warning signs during the earliest stages of disease. Sometimes they stay completely silent. This is one of the most important messages in today's video. Feeling healthy and being healthy are not always the same thing. Some conditions, including precancerous colon polyps, can develop silently for years without causing pain, without causing bleeding, and without causing any noticeable symptoms. That is exactly why screening is so important. So what exactly is a colon polyp? A polyp is a small growth that develops from the inner lining of the colon. Most polyps are harmless when they first appear. However, some types can slowly change over time and eventually become colorectal cancer. The good news is that this process usually takes many years. That gives doctors an opportunity to find these polyps early and remove them before they become dangerous. But why do these polyps remain silent for such a long time? Let us take a closer look. Most colon polyps are very small when they first develop. At this stage, they usually do not block the bowel. They do not cause pain, and they rarely cause bleeding. That is why many people have no idea that a polyp is growing inside their colon. Pain is one of the symptoms people expect the most. But colon polyps usually do not have nerves that produce pain. Unless they become very large or cause complications, they often remain completely painless. Some polyps may bleed very slowly. The amount of blood can be so small that it cannot be seen with the naked eye. In many cases, the first clue is a routine stool test or a colonoscopy rather than visible bleeding. Many people believe that constipation or diarrhea always means something serious. In reality, most early polyps do not change bowel habits at all. Your digestion may seem completely normal while the polyp continues to grow. This is why colorectal cancer screening is so important. The body may not send any warning signs during the early stages. Waiting until symptoms appear may mean waiting until the disease has already progressed. This is one of the biggest misconceptions in medicine. Feeling well is wonderful, but it does not always tell us what is happening inside the body. Many conditions remain silent for years. Colon polyps are one of the best examples. Most colorectal cancers do not appear overnight. They usually begin as a small polyp. Over several years, some polyps slowly become larger. A small number of them can eventually develop into cancer. This slow process gives us a valuable opportunity to intervene early. For many people, this transformation takes 7 to 10 years or sometimes even longer. That means there's a long window of opportunity to detect and remove precancerous polyps before they become dangerous. Time is actually on our side if screening is performed at the right moment. This is exactly why doctors recommend screening colonoscopy. The goal is not simply to find cancer early. The real goal is to stop cancer from developing in the first place. Very few screening tests have this unique ability. Let us go back to John. He decided not to cancel his appointment, even though he still believed nothing was wrong. He completed the bowel preparation, arrived for his colonoscopy, and hoped everything would be normal. During John's colonoscopy, the doctor found a large colon polyp. John was surprised because he had felt completely healthy. He had no symptoms and no reason to believe anything was wrong. Yet there it was, a precancerous polyp quietly growing inside his colon. The good news is that the polyp was removed during the same procedure. John did not need another operation. He did not need chemotherapy. He did not need radiation therapy. The problem was treated before it had the chance to become something much more serious. This is what makes colonoscopy different from many other screening tests. Most screening tests are designed to detect disease. A colonoscopy can actually help prevent disease by removing precancerous polyps before they become cancer. That is one of the greatest advantages of this procedure. Because John's polyp was removed early, it never had the opportunity to continue growing. It never became invasive cancer. This is why doctors often say that colonoscopy does more than detect colorectal cancer. It can help prevent it. Colonoscopy allows doctors to examine the entire lining of the large intestine using a flexible camera. If a suspicious polyp is found, it can often be removed immediately. That means diagnosis and treatment can happen during the same procedure. Removing a polyp is usually painless because the inner lining of the colon does not feel pain in the same way that skin does. Special instruments are passed through the colonoscope to safely remove the polyp. The tissue is then sent to a laboratory where it is examined under a microscope. It is important to remember that not every polyp will become cancer. In fact, many polyps never do. However, some types have a much higher chance of becoming cancer over time. Since it is impossible to know with certainty just by looking at them, doctors usually recommend removing polyps whenever it is safe to do so. Now, you may be wondering whether you should have a screening colonoscopy. The answer depends on your age, your medical history, your family history, and your personal risk factors. For many adults, at average risk, screening usually begins at the age of 45. If you are at average risk and have no symptoms, current guidelines generally recommend beginning colorectal cancer screening at the age of 45. There are several different screening options available, and your healthcare provider can help determine which one is most appropriate for you. Not everyone should wait until the age of 45. Some people need to begin screening much earlier because their risk is higher than average. Understanding your own risk is one of the most important steps in protecting your health. People living with ulcerative colitis or Crohn's disease that affects the colon may also have a higher risk of colorectal cancer. These patients usually follow a different surveillance schedule that is based on the duration and extent of their disease. If you have inflammatory bowel disease, regular follow-up is especially important. If you have already had colon polyps removed in the past, you will usually need another colonoscopy in the future. The timing depends on the number, the size, and the type of polyps that were found. Your doctor will recommend the safest follow-up interval for you. A small number of people inherit genetic conditions that greatly increase their risk of colorectal cancer. These conditions are uncommon, but they require special screening programs that often begin at a much younger age. If several members of your family developed colorectal cancer at a young age, genetic counseling may be recommended. Many people ask if they must have a colonoscopy. The answer is no. Today there are several screening methods available. Each has advantages and limitations. The most appropriate test depends on your personal situation and should be discussed with your healthcare provider. Stool-based screening tests can be an excellent option for many people at average risk. These tests look for hidden blood or abnormal DNA that may suggest the presence of colorectal cancer or advanced polyps. They are simple, convenient, and can often be completed at home. If a stool-based screening test comes back positive, the next step is a colonoscopy. The stool test helps identify people who may need further evaluation. But only a colonoscopy allows doctors to directly examine the colon and remove polyps if they are found. One of the biggest mistakes people make is waiting until symptoms appear. By the time pain, bleeding, or unexplained weight loss develops, the disease may already be more advanced. Screening is designed to find problems before they become symptoms. That is why timing matters. If you notice blood in your stool, a persistent change in your bowel habits, unexplained weight loss, ongoing abdominal pain, or iron deficiency anemia, you should seek medical evaluation promptly. These symptoms do not always mean cancer, but they should never be ignored. Let us go back to John one last time. He almost canceled his appointment because he felt perfectly healthy. Fortunately, he decided to keep it. That simple decision may have prevented colorectal cancer from ever developing. If John had postponed his colonoscopy for several more years, the outcome might have been completely different. No one can predict exactly what would have happened. But removing his precancerous polyp gave him the best possible chance to avoid colorectal cancer. That is exactly what screening is meant to achieve. People often think that screening is about finding cancer. In reality, the greatest success of screening is preventing cancer before it begins. That is why colorectal cancer screening has saved so many lives around the world. Scheduling a screening test may seem like a small decision today, but years from now it could become one of the most important healthcare decisions you ever made. Sometimes prevention begins with a single appointment. If you are unsure whether you should be screened, talk with your healthcare provider. Together you can choose the screening strategy that best matches your age, your medical history, and your individual risk. The best screening test is the one that gets done. If you notice blood in your stool, a persistent change in bowel habits, whether constipation, diarrhea, or thinner stools, should also be evaluated, especially if it continues for several weeks. Unexplained weight loss may have many possible causes, but it should always be discussed with your doctor, especially if it happens without trying to lose weight. Persistent abdominal pain is another reason to seek medical advice. Pain that does not improve should never be ignored. Iron deficiency anemia, especially in adults, may sometimes be the first sign of hidden bleeding from the digestive tract. Your doctor may recommend further evaluation. They do not always mean cancer, but they should always be evaluated by a healthcare professional. Remember, symptoms require medical evaluation. Screening is designed for people who feel completely well. Do not confuse these two situations. John felt completely healthy. He had no pain, no bleeding, no changes in his bowel habits. He almost decided to skip his colonoscopy. Fortunately, John kept his appointment. During the colonoscopy, a precancerous polyp was found. It was removed immediately, before it ever had the chance to become cancer. The purpose of screening is prevention, not simply finding cancer. The best outcome is preventing cancer from developing in the first place. Do not wait until symptoms appear before thinking about prevention. The earlier a problem is found, the easier it is usually to treat. One important message to remember is this: the best screening test is the one that you actually complete. Doing something is always better than doing nothing. If you have questions about colorectal cancer screening, talk with your healthcare professional. The right screening test at the right time can make a lifelong difference. Screening protects your future health. A simple examination today may prevent a serious illness years from now. That is why screening saves lives. Thank you very much for watching. If you found this video helpful, please subscribe for more evidence-based gastrointestinal health education. In our next episode, we will answer another important question.